if you want to go ahead and bring up the slides, I'll get started.
Okay.
Hey, good morning, everyone. Thanks for your time. Or actually, I guess maybe for some of you, if you're on the East Coast, good afternoon, or good noon, afternoon coming. What we're going to do is I'm going to walk through. I probably won't spend a lot of time setting this up because I think we've got just a very good overview from an industry point of view just a couple of minutes ago. Can we start at the beginning? There we go. Go ahead and take the next slide. So from an industry perspective, and I know you guys have seen 100 different versions of this slide. You know, healthcare is transforming. There are pandemic economics. We've listened to a lot of that here recently. Per capita costs are going up. There's this changing view of health around pop health and some things like that. So let's just drill into a couple of these, and I think we can shift over to the EPM portion pretty quickly. Go ahead and take the next slide, sorry. So I think we are always focused on the 360-degree view of the patient, social determinants of health becoming an emerging component. Actually, even before, you know, this is pre-COVID, SDOH was a very, very hot topic. I think it's interesting. I think some of the biggest social determinants of health around things like isolation and economics and job security and things like that are people are struggling in that category. So I'm seeing an increase from a payer point of view in even some of the behavioral health and some of the counseling service because people are isolated at home and trying to figure out how to move forward. There is a shift to well care going on. We're seeing big deferrals of elective procedures and things like that, but trying to bring telehealth out. And I'll get into the consumerism side here in just a few minutes. And then probably one of the biggest things is the aging population has gotten a big emphasis during this COVID period, frankly, because there are a lot of the folks that are being directly impacted. But what are we seeing? You know, on the economic side, one of the biggest negatives is, you know, there's 14,000 roughly skilled nursing facilities in the U.S. today, and we're seeing a big challenge. I think 40%, the last stat that I saw from the AHCA said that 40% of those are at risk of closing. And so we're starting to see trends like a shift to home care and some things like that. How are we going to adapt and modify the provider model from that point of view? Now, one of the things I do want to say this, and in deference to the kickoff, I think if I were to ask a lot of you, what is the most significant event that has impacted your scenario planning in the past 12 months, I don't think COVID would be your answer. I actually think the repeal of the HIF would be your answer. Maybe you guys would have a different opinion, and that would be a great topic to come up with during the happy hour this afternoon. Oh, I don't know if it's a happy hour, the Q&A. It'll be a happy hour for me. But I think I'd be interested to see, is COVID really what you're focused on, or is it the repeal of the HIF and you know, how that's going to impact premiums, how that's going to impact EPS and some things like that. So that's just kind of some thoughts that I have on the changing view of health. I'm going to let Patrick, who's kind of much smarter than me on the finance side of things, talk about the per capita cost a little.
Hey, thanks, Greg. So just a couple points on the cost side of the equation. And this has all been about reducing costs and how to reduce cost while we keep the member experience, you know, better. So there's this continued push from away from fee for service that we've been on for such a long time towards a more value-based payment model. You know, I know CMS is really pushing the primary care market to that this year, really looking at options for value-based payments when it comes to primary care. A lot of the private insurance companies have really been taking a look at their provider market, providers, really tiering out their providers for those who are really looking to provide outcome-based care and really driving reimbursement towards those. In fact, some of them have maybe been more aggressive about actually dropping providers that have not been willing to go in that model and really focusing in on a really select group of providers that really want to go for a more outcomes-based model. We've seen as we've seen the healthcare provider market consolidate. Now we're finally seeing efficiencies. We're finally seeing some coordination across their network. So they're really getting better at looking at the resources, sharing the resources across all the organizations, and being more efficient from an overall care perspective. Big push, as Greg mentioned, to home health care, to outpatients type services, really a more cost-effective way of treating patients, and really focusing more from an outcomes perspective there about how we treat patients, and effective models there. And then it's interesting, the whole COVID situation has really highlighted what, a lot of us always recognized was there, is really the inefficiencies in the healthcare supply chain process, about how we really had a tight alignment between our suppliers and our distributors, and the providers actually providing the supplies. So this has really driven them to look at models from outside of healthcare, of saying, how can I bring demand and supply together, do more active planning and coordination between both groups. So again, we're trying to lower the overall efficiency and cost of supplies in the healthcare market.
I think that one of the things that I'll be interested in is 5 years from now, when we look back at this moment in time, I think we'll certainly remember the challenges that we've gone through, but I think this is the catalyst that's driving the digital innovation of the next generation. Our industry has been slow to adopt new technology and new ways to do things, and this has driven across every industry. I can't tell you how it seemed overnight that when the restaurant industry shut down, how quickly online menus became available through mobile apps, and I could click a couple of clicks, order my food, pull in, somebody hands it through the window with a mask on, and out the door. So the innovation that is happening, or just kind of the shift to digital, we've always talked about it, but we lacked a crisis to really force us to head in that direction. Telehealth, I think that won't go back to pre-COVID levels when this is over. I think people are embracing telehealth, they're embracing virtual care, and I think we'll see more and more both the provider side trying to adopt telehealth because it's more convenient, and in a value-based payment model, I don't need to see every patient in the hospital or in my office. I can do a telehealth visit. I can get a lot more of those done per hour, and kind of continue to grow my profitability on the provider side. There is this consumerism push to change the patient experience. And I think one of the biggest challenges around the patient experience is interoperability. And so until we really improve transparency and interoperability, not just between provider and payer, not just between provider and provider, but across state lines and in these care islands that we live in today, those will be some of the challenges. Go ahead and take the next slide, Shinka. And that is some of the kind of impact on the outlook. We are seeing improved diagnostic testing. We're seeing improved. I think the pace of change that the FDA has gone through to allow innovation to happen, I don't think we'll go back. I don't believe that will go back to pre-COVID levels as well. I think we'll see an increased drive to innovate and bring drugs to market faster, but still do so safely, following all the clinical trial protocols and things like that. I think we'll see a drive to more and more personalized medicine, health avatars. It's funny, that's almost a dated statement today, because when I look at some of the things that are being done by companies like BehaveVR, so virtual reality therapies and things like that, not just cognitive, but actual VR based. I think there's some amazing innovations that are going on, and we'll look back on this time once we're kind of over the challenges, and we'll be excited about all the innovation that happens. Now, that being said, I think there are some financial impacts and some financial things that we need to look at. We have seen an increase in the number of COVID-based admits. The cost per admit has definitely gone up, but Patrick, you may have some point of view on how that's being offset on the on the elective side of things.
Yeah, if you look at that, Greg, that's definitely been focused for a lot of people on the call. Is as you're right, cost per admits the COVID were very intensive, costly cases. But the flip side of it was the all the elective costs, all the elective procedures were basically eliminated for a long time in the healthcare market. So what we're seeing with a lot of our customers, and probably with a lot of you on the phone, is scenarios where you're actually been more than offset with your reduced elective costs, the additional costs of all the COVID related cases. So in most cases, you're dealing with surpluses. And now it's a plan of what do you want to do from a surplus perspective? Do you have potential to rebate some of that back to your members, or do you look at other options right now from a planning perspective while you're in the year to look at this situation where COVID costs and the offset of elective surgeries have really swung in your guys' direction from a surplus standpoint. So I think it fits perfectly into just talking about what options we have out there from a scenario perspective. I know Shankar's got some great perspectives on what we do what we can do from a solution perspective to help customers really promote and really analyze what's going on from a scenario standpoint. Okay. You can pop to the next slide, Shankar. There you go. Okay. It shows yours.
Okay, I'll take over from here. Can you guys hear me fine?
Yes.
Okay, great. So I just wanted to dwell on a McKinsey study, which basically talked about the disruption horizon. They created this in the context of the current crisis we are in around COVID, but it generally applies broadly, like Patrick and Greg mentioned. You guys may be more impacted ahead of time, even before the crisis took effect. So these horizons are basically broken up into 5 sectors, right? So you have the resolve, which basically means that the companies are focused on addressing the immediate challenges of COVID, which represents the institute's workforce, their customers, their technology, and the business partners, how they impacted. In the second phase of it, and the resolve phase was really around the March timeframe, and the resilience is where most customers were on from April onwards. So this is the phase where you had to manage the near-term cash and challenges and broader resiliency issues during virus-related shutdowns and economic knockdown effects. So all of those had to be considered and resolved within the organization fairly rapidly during that resilience phase. And most companies are, what we are finding, are in that phase 2, phase 3 time area, right? So the return is basically, we didn't know at that point whether there's going to be a second wave. So companies were really starting to create detailed plans on return to business, no matter which industry you look at, to scale back quickly to pre-COVID situations, and understand the knock-on effects to make it more clear to their audiences also. And the reimagination is basically taking to the next normal. What does a discontinuous shift look like, and what are the implications, and how institutions should reinvent? And we're not there yet, because we're still uncertain about where that leads to, because we're still tackling from a company standpoint between phase 2 and phase 3. And the reform phase is where you're really clear about how regulatory and competitive environments will shift based on how the COVID situation drags on or gets resolved. So from that'll really be determined based on the timing. So this is kind of how McKinsey envisioned companies are dealing with crisis, and this is based on their experience dealing with past crisis situations. Just jumping into, from a solution standpoint, where do we come in terms of these phases which McKinsey outlined, right? From our solution standpoint on EPM, we have a long-range planning solution, which has been fairly widely used across more than 600 of our customers actively using for long-range planning. And if you think about it from a risk and uncertainty standpoint, long-range planning essentially involves various corporate initiatives which are more strategic which have an impact on their P&L, on their balance sheet, and also M&A activity, which can most often impact beyond the 1 year horizon, right? So you want to plan scenarios around that, and understand the impact of that if the deal period gets delayed, or if you have cash surplus in a upcoming quarter, then how do you deal with it? Is there any acquisition targets you need to consider? So those are very common scenarios across industries, and treasury is most often affected. As long as cash is affected, treasury is always involved, right? So the key value propositions from a long range standpoint is from a solution which we have, which companies very often use this scenario modeling for, is for liquidity planning, capital risk modeling, which is in the healthcare provider industries, the RBC, or the risk-based capital measurement of the minimal capital appropriated for the reporting entity to support your overall business, right? So that's something which we can do in the solution. And balance sheet mix in terms of how your debt to equity ratio is and the working capital ratio is, and how your cash position related to the other assets are. These are very fundamental scenario modeling impacts from a long range planning, no matter whether you consider corporate initiatives or M&A activity or treasury activity. And going back to what Greg and Patrick were mentioning, when you talk about value-based reimbursements or the enormous digital transformation happening in this industry, those can have significant impact on the balance sheet, and you need to consider that before embarking on those initiatives. So typically, long-range planning involves a lot of uncertainty, and the solution is built with that in mind. And that closely ties back to your operational planning, which is typically the 1 year or less horizon. And that's what the solution has been primarily meant for. But with the COVID scenario, a lot of companies are seeing the utility value of the solution more from a near-term perspective. And these numbers are coming in from a Gartner survey across the industries. And we are seeing that over 75% of the companies are forecasting for multiple scenarios because the uncertainty is so high. The ability to determine exactly what's going to be your next month or next 2 months outlook going to look like is not clear. And so you want to factor in all those various KPIs you want to consider and blow them into a couple of scenarios, in the best case, worst case, and the most plausible case. And that's what many companies are doing. But they're not, some of them are doing it in Excel, using their existing tools, but it doesn't suffice, right? It doesn't satisfy the full needs of the situation we are in. And we saw the pandemics are not new. We had it from 100 years back. We didn't have solutions before. We had crisis situations from the 2008 crisis, but the solutions have improved tremendously today. And what we have in EPM allows you to not only do that multiple scenario planning, but everything else which Gartner identified, which is do that short-term rolling forecast, while at the same time performing range-based rather than point forecast, right? So that illustration I have at the bottom left side here, or right side, showcases how that happens, right? You could create models for specific regions which are highly impacted by COVID situations. You can probably divide it by states in the US, and based on the policies within each state, based on mask adoptions within each state, or the infection spreads, you can divide that region by region across the US, for example. And each of these can have scenarios built in for each region. And then you can blend those scenarios and map them into your regular operational planning, which is happening. And that's what we call by range-based forecasting, to allow you to create multiple scenarios and then bring them together at the corporate level and see what's going on and how you need to change what you're doing. So what we are essentially saying is that what a solution we had for long-range planning, which over 600 customers have been using, are perfectly applicable in a short range cycle also. And this is what Gartner is recommending many companies to do, to not only do forecasting for multiple scenarios, but also focus on range-based forecasting rather than point forecast. And COVID emphasizes that these are focused on the short-term cycle. More from an industry-specific standpoint, there is a lot of decision impacts, right? I mean, you guys know that better. I'm more of a product person than an industry expert here. But I think from a membership changes due to job losses, we have more than 5.4 million American workers who have lost their health insurance from February through May. Then, there was a Kaiser study, I believe, which estimate that about more than 27 million are in risk of losing coverage due to COVID pandemic. So there's a lot of volatility in terms of claims, in terms of membership changes. And also you have the younger groups of who traditionally thought that they were good in health, who wanted that coverage. So there's also, in terms of risk tolerance impacts, what you thought was not risky before is now, those same people are more risk averse. And so there's also this increased liability in terms of compensation coverage for first responders and healthcare workers, which impact the volatility aspect. So looking at that illustration which I have, and I want to just walk you through, what could be probably a model. I mean, this can be modeled in any which way you can, but I just illustrated one simple example, right? If you have multiple scenarios, for example, you have low infection rate and a baseline infection rate, which is your pre-COVID normal, and you might have high infection rate. So this, as I said, you could break it by, in the US, for example, by states or by US East, West kind of areas, or you can break it up by line of businesses. The model is up to you to define what exactly makes up a model. And the scenarios are totally up to you. So based on the model definition, the scenarios might change because that's what you're really trying to model around, right? So, and we allow you to create n number of scenarios. I just illustrated 3 of them here. So what you would do is basically create a model. In my illustration here, it might be a region within the US. And you would say, okay, region 1 has these 3 scenarios. Region 2 might have the same 3, or it might have 4 or 5 more based on the risk level. And once you have these scenarios, you model for each region independently. And when you model them, you can work in silos. You may have person A responsible for region 1, and they can model that, and they can look at what their outlook is from a P&L and balance sheet standpoint. They can bring it all together across regions when they start blending things in. And that's what we call as within the product, we call it as business case, but essentially they turn out to be decision choices, right? So what that ties back to that previous illustration I have, where you actually blending scenarios from various models. So for example, your overall corporate outlook for your best case might be region 1 being a low infection rate, region 2 might be a baseline, and region 3 may be a highly infected rate. So each region model can contribute a different scenario into that business case, which means the decision choice is based on the most practical or most plausible scenario. So each of these decision choices, which is best case, likely case, or worst case, can pick up independent scenarios from those regions, and you can blend them together. That's what gives you that range-based forecasting, which Gartner was laying out. And this can be played out across the board. You can create n number of models, bring them together into a blended scenario, and then tie them back to your operational plans. And that's what really scenario modeling with an EPM allows you to do. And jumping into a more deeper level of functional benefits you get out of here. So everything on that left side here, I outline some of the key capabilities which allow you to do that income statement and balance sheet forecasting. right? I just wanted to highlight some of these key ones. So essentially you can do goal seeking. For example, you can say, set a target for a simple use case might be EPS. And say based on the key drivers which impact EPS, you can say if I have a goal of a certain EPS based on the COVID scenario, or it could be your cash position, for example, what should be how should my assumptions change, right? So your driver impacts are immediately calculated to say if you change your driver by this is what you're going to be on the EPS side. To get this EPS, this is what you need to change on the driver, right? So you get that immediacy for each of the models. So you can model for anything you want within the balance sheet or income statement as your target goal, and then get that driver dependency laid out to you within a matter of seconds. The same way Audit Trail. Audit Trail is a wonderful feature which allows you to drill into the calculations, which are pretty intensive in terms of your industry needs. You can model for anything within P&L or balance sheet and drill down into those calculations to see what made up those calculations, what numbers contributed to those calculations, and at the same time go ahead and change those numbers and see that calculated number change rapidly in your face, right? And Scenario Manager is fundamental. That's a feature built in within the product, and it's pretty much the heart and soul of scenario modeling in EPM, right? The difference between what you typically do in an Excel world is that, yes, you can create scenarios in Excel, you can compare them, or even in any other tool available in the market. But what the solution does is allows you to inherit scenarios across from baseline, for instance, because most often you have specific drivers which impact your end results. And you don't want to be going around changing every account in there. You don't want to be copying data. So you want to basically focus on specific scenarios and say that every number in the P&L outside of these key drivers are going to be inherited from another scenario. So in my example in the previous slide, your baseline scenario may be having all your accounts, and your high infection rate might be a scenario which takes every number from that baseline scenario, except for the key drivers which impact that high infection rate scenario, right? So which means that there is no copy data, there is no need to actually impact across all the accounts. You can just focus on specific accounts as your key impact areas for a specific scenario, and then see your results across the board, across the entire P&L and balance sheet pretty much right away, right? And I'll touch on the Monte Carlo in another slide because that's a key component. So if you look at the right side here, essentially that gives you the flow of what typically the solution delivers and how it's being used, right? So you model for each scenario. For all the models you create, you blend the model scenarios, which means you decide which scenario from which model you want to contribute to that unified blended scenario at the corporate level, and that's your business case. And then you basically, that gives you that proposal for decision making. And then once you have that, you do your reporting analysis on that. You can take those numbers and funnel them through your operating plan so that you can go ahead and have those bottom-up planning done. So the key value propositions are really range-based scenario forecasting, which allows you to cherry pick which scenario from which model you want to bring in. Cash flow and balance sheet forecasting, because P&L forecasting is a done deal. A lot of vendors can do that. A lot of customers are doing that even in Excel. But when it comes to balance sheet forecasting, that's where the tricky part of it in terms of the solutions capabilities resonate, right? For example, that funding options in debt scheduler, which I have as a feature within that, which allows you model for your balance sheet based on funding options you have available at any given time. And based on your interest rate, you can change your funding options and change your equity versus debt mix. And decide how your balance sheet needs to look for each scenario. And it may be different for each scenario, and then you can go ahead and decide which scenario you want to pick up. So in a nutshell, essentially, it's about managing liquidity and managing risk and uncertainty. Just diving a little bit deeper, because obviously we're not doing any demos in this session, but we wanted to kind of talk through some of the key aspects which are very unique, right? As I mentioned before, you can create models on the fly. You can decide what is going to be a model. In my example, it happened to be regions or states. You can decide what your model needs to be. You can create n number of scenarios for each of those models. You can blend those scenarios across models, and you can flex time duration across models, right? So this some models can be by the day, some models can be by the month. In a long range time horizon, it might be a mix of months and years, which means that the outer years might be by year because you're forecasting by the year, and the near term months would be by the month, which is practical. And then the closest month might be even by the week, right? So you can change your time horizon within one single model and lay it out in one simple grid like that illustration shows you. So I have an example here from a insurance provider kind of use case of how you would lay it out. And this can be broken up in terms of various time period horizons within the same grid, which allows you to do a lot of scenario modeling and see the impact not just in the near term, but also in the long term. So that flexibility in time duration is something which is very unique and important. And out-of-the-box financial statements, which means as and when you change these drivers and see the impact, you can tab over and see the impact on your income statement and balance sheet and any custom reports you create. And those are on the fly. And these are in-memory calculated, which means that you can see your impact and you can discard your entire model calculations, or you can check them in, which means that they are submitted and they are persisted within the model for somebody else to reuse, right? So out-of-the-box financial statements are another big value. We also have industry templates which we provide out of the box, which are not there for the provider as such right now, but we do have demos, material content, and many of our partners like Interel can showcase this in the context of a specific industry. One of the benefits which is probably less nowadays is the offline modeling, where you can actually take the entire model in Excel, take it away in a flight, put on airplane mode, start working on it, and then when you reach back, you can just sync it back, right? So that's also possible now. So it's totally integrated within the EPM platform, which means it ties back, these models are tied back to your dashboards. It's integrated into Excel through the SmartView for Office. And you can do ad hoc analysis on the fly from a reporting and distribution standpoint. And it also ties back to the overall EPM cloud flow of structured navigation. So which means that scenario modeling can be blended together with the operational modeling, and you can commingle them and see them side by side. And the integration from a source and reporting standpoint is also pretty seamless. We can bring the data in from any source and report and take it out if you need to report out of EPM. We tie back to the Oracle Analytics Cloud, so you can do that also. And again, just harping on some of the key aspects and gives you some more visuals in terms of how you can lay out your reports right within each model. So these in the middle, I show you the reports list, which gives you some of the key reports which are delivered out of the box, or you can also create them custom reports. So this gives you a good opportunity to create more balance sheet focused and go beyond the income statement, which typically a lot of the solutions focus on. One key aspect is the Monte Carlo simulation, which is available through the solution. And this is very useful no matter which industry you're on, and especially in the healthcare industry, right? You can simulate around range-based assumptions. So what this allows you to do is take specific assumptions. I give some examples here. It might be different, but here you have, I can focus on in that grid, which I showed in the previous slide. I can focus on total enrollees, total number of infected number of confirmed cases, number of hospitalized patients. And those might be in my assumptions, might be having a specific value within my income statement or balance sheet, which is my focus for target as my forecast target, right? So how do these impact? So what this gives you is a level of certainty. If these are my driver assumptions, how reliable is my forecast for my target? And immediately it runs through a Monte Carlo simulation. You can run up to 1,000 trials. It takes more than 13 methods of simulation, and you can decide which method you want to pick up. And then based on that, it'll give you a certainty of achieving, right? So this, based on your risk tolerance and your risk aversion, you can decide based on that, do you want to lean more towards the worst case scenario, or do you want to lean more towards the best case in terms of your outcome? So that gives you some guidance in terms of what your forecast will turn out to be based on which side you lean. And you can always revise your new target. So it lets you revise targets and rerun that Monte Carlo simulation to see the revisions in that certainty of achieving that. Right, so it's Monte Carlo simulation is very ideal for black swan events to assess the risk base on your tolerance. Okay. So strategic modeling and long range planning, as Ed was mentioning earlier, so it basically ties back to your overall EPM foundation. So which means that you have your operational planning, you have your close, you have your reporting, and you have intelligence, which is built into the entire platform, which all ties together. And so you can do your strategic modeling and long-range planning and push your numbers down to your operational plans. You can feed your actuals from your close and bring them together in your operational plan. And allocations, if needs to be done for profitability analysis, that can also be done within the same solution. So EPM Cloud essentially brings all the components together. I kind of focused on the strategic modeling and the long-range planning aspect of it, but there's more to it, and you'll hear more about this as we go on in this session. But hopefully this was useful for you in terms of understanding how you can benefit from the solution based on everything which Patrick and Greg mentioned earlier, in terms of how you can use this in the context in which you have in your industry. So with that, I wanted to just see if you have any questions.